Welcome to the Newsmaker. Air pollution is the new tobacco, that's according to the World Health Organization. It says that 1/3 of deaths from stroke, lung cancer and heart disease are due to air pollution. That's equivalent to smoking tobacco and much higher than, let's say, the effects of eating too much salt. Joining me now to discuss at the first WHO Global Conference on Air Pollution and Health is Maria Neira. She's the WHO Director at the Department of Public Health and the Environment. Thank you so much for joining us. So first of all, let's jump right into the topic, Maria. Is air pollution the new tobacco?
Air pollution is many things. We use the analogy to tobacco because 40, 50 years ago it was extremely important to raise awareness about tobacco, to create at the government level of all of those policies that took us as far as having even a framework convention. So now we need to, while continuing the terrible fight against tobacco, we need as well to scale up dramatically the fight against air pollution, learning from the tobacco and probably creating such a strong movement as the one that was created around tobacco.
It is a huge issue, but what is the scientific evidence behind all that?
We have tons of scientific evidence and telling us a terrible figure. Every year, 7 million deaths are caused by exposure to air pollution. 7 million deaths every year. There is nothing else comparable with this. And this is all because of the toxic air we are breathing. This is totally absurd. It's somehow unacceptable. And particularly when the solutions are there and when we can do a lot of things to stop this toxic air getting into our lungs, getting into our body, and affecting almost all our organs.
You're mentioning the solutions. What are some of the top solutions that you're seeing right now?
Okay, we need to look at what is causing pollution. And in most of our countries, the pollution, the sources of pollution are due to the fact of the sources of energy we are using. If we keep using fossil fuels, or if we are keeping burning coal to produce our energy, if we have industrial processes that are not well regulated, if we are incinerating waste, as is the case in some developing countries around the world, or if we don't use our energy in a very efficient way, then we will have a problem with the pollution, plus the transport, of course, the vehicles, and the fact that our transport is contributing as well.
You previously mentioned, Maria, that if politicians do not act now, they could be taken to court by citizens in the future. What will this mean exactly?
Well, what means that the point here is that nobody will be able to say, I didn't know. I mean, now the evidence is everywhere, thanks to you, to the media, thanks to NGOs, thanks to civil society, of course, thanks to politicians and governments and institutions, and of course, thanks to WHO and other UN agencies, that we are raising awareness. We are making sure that people understand that this is an alert. And it's an alert that has been with us for a long time. And now we cannot continue with this trend. I mean, our lungs and our brains and our hearts are paying the price of this horrible pollution that is affecting all of us.
And the WHO has convened the first conference on air pollution and health in Geneva this week, but why not sooner?
Well, sooner we have been doing plenty of activities and initiatives, and we have been fighting. Actually, today I was presenting at the conference a little bit the history of air pollution, and once upon a time, in the 58, already WHO did the first kind of report on the influence and the impact of air pollution and the health of the people. Since then, we have been developing tools, raising awareness, creating this big tool which is called the Breathe Life campaign, bringing all ministers of energy, health and environment together. And I think we have been doing a lot of noise and implementing a lot of activities, but now it was time to really put everything together, shaking a little bit everyone around and saying we are not leaving WHO in 3 days from now without the desire and the commitment to really scale up on a dramatic, massive way, and making sure that now things are going to change on a completely different scale.
And your new report released on Monday also opened a lot of eyes. It basically said that 93% of children around the world under the age of 15, that's 1.8 billion children, they breathe toxic air. What are the main causes for that?
Yeah, we knew how air pollution was affecting all of us, adults, and we have been producing evidence for many years. But we thought that focusing on children will be extremely important, because obviously it's not the fact that air pollution is killing every year 600,000 children less than 15 years old, which is already a figure that will wake up all of us and make sure that we will be determined to take more action. But it takes as well another factor, which is that if you are exposed when you are pregnant or postnatal or your childhood, if you are exposed to air pollution, not only you are suffering the diseases now, but you are putting at risk your neurodevelopmental, that means that your brain, your intelligence, your cognitive capacity will not be developed as it should. So we are putting at risk the future of these children that might even have the, problems with the cognitive development. Is that what we want for our children? Of course, we will do the same with their lungs, because their lungs are developed. So if you are exposed to air pollution, that development will not occur well. So you will develop chronic diseases when you will be an adult. And asthma. Asthma is something that everybody understands. There is an increase in asthma cases, and we know that there is a clear relationship, clear linkages between exposure to air pollution and increased possibility of having asthma. And for those who are asthmatic, if you are breathing toxic air, obviously this is not helping you at all.
And if we talk about statistics, 1 in 10 children under the age of 5 actually die today from air pollution. So
Yes.
as a mom, how could I better protect my children?
I think the best protection will be to put a lot of pressure on your politicians, on your governments, on your mayors, on your whoever can reduce the sources of pollution. Because, of course, once the pollution is there, you might have little measures to reduce exposure. But the only way to solve this problem is to avoid the sources of pollution. So it's, you need to go to the source. And as a parent, as I say, be aware, be very demanding, use your votes to promote or not your mayors, and make sure that you live in places where you are not destroying the future of your children. If they control every day the quality of the air you are breathing, and then if it's not the right one, make sure that you demonstrate, you protest, that you go. Of course, individually, there are things we can do. It's not only put pressure on politicians. We can reduce our own production of waste. We need to be more careful with recycling. We need to be careful with the use of the energy and be more efficient on the way we use our energy. We need to rely less on our private car and use more the public transport. And we need to educate our children on something which is more sustainable and a future that is not all based on polluting our future.
Now, here at the first WHO conference on that topic, do you feel that the world leaders, the health ministers, scientists and heads of international organizations actually make real action and have an impact on the ground? Do you feel a sense of urgency here?
There is a sense of urgency, and not only, I mean, there is a space for hope, because we see as well, and tomorrow will be an important day because we will be talking about solutions and interventions. The good thing is that when you put in place an intervention to reduce air pollution and you reduce it, the health benefits are almost immediate. And I think we can look at the example of China. China has declared war on pollution as the national priority. And of course, it's one of the most polluted places yet, but the trends were increasing. And now what we see is that they're stabilizing, and hopefully they will start to go down, because they decided, for instance, to close down the coal power plants in the country, most of them. So, and that is an immediate effect. Not use of coal, you will reduce dramatically the pollution.
Oftentimes, though, I've lived in China for 5 years in Beijing, so I've experienced the pollution and smog firsthand, wearing facial masks and having an air purifier at home. The problem often is the lack of data and non-transparency of government data as well. When you compare, for example, the air quality index by the US Embassy in Beijing and the official data, how do you cope with that?
Okay, there is a tool in WHO where you have a computer, you have internet connection, you can go there. There is a map, an interactive map, where you can see what is the pollution level. And there is no way to hide that information for one reason, because we use ground level data. We use a mathematical model of chemical substance that they travel, and we extrapolate from there some data. Plus, we use satellite data. And we have space agencies collaborating with us. So that is very difficult to hide something like that. In addition to that, now any citizen can have their own way to measure and to have. So in the past, maybe it was more difficult. Now there are no excuses. We all know the levels. And this makes, and you feel it. If you were living there, I'm sure you were feeling it.
There's been a big improvement as well. Now the WHO is an international organization, and very often it is political as well. Are you not often feeling that your hands are tied when you want to implement public health policies because of political inaction?
You see, I mean, being political is extremely important, because public health is something about political, the good policies, of course, the good politics, not the party, but the good policies, because nothing is more important than public health. We don't feel that our hands are tied when it's about putting the situation, presenting the data, demonstrating how are the levels, talking about how many deaths are associated with those levels, because we don't have any problem in doing that. Obviously, if you are in charge of such a challenging public health issue, you will always want to do much more, much more. We don't have the capacity to tell the governments, do it. We don't have any legally binding instrument, but we are convinced that they will all realize the benefits, the enormous benefits of doing this fight against air pollution. Benefits for the climate change agenda, benefits for cleaning the air, benefits for business if they are looking for economic reasons, and obviously all common sense, because what we are promoting and proposing are common sense measures that will be generating fantastic health benefits.
Cutting carbon emissions obviously is key there as well, but with, for example, the US threatening to pull out of the Paris climate deal as well, and political resistance in many countries, what does that mean? Is it not mission impossible now to improve the public health systems?
You know, maybe I'm a very optimistic, pathologically optimistic person, but when you work on public health, you don't have a choice. You have to be very optimistic. I was in San Francisco a couple of months ago on a big conference organized by Governor Brown on climate change, and I came back with a lot of optimism, because yes, it's true that maybe at the national level the intention to withdraw from the Paris Treaty, but I saw a lot of action at the different places in the United States, different governments, different governors, and local action, and this is very stimulating. On the other hand, politically speaking, who will disagree with the need of clean air for our citizens? Who will disagree with that? Nobody. I mean, you can maybe have other policies and you can explain it, but I don't think any mom will buy an argument and say, no, the air has to be polluted and your child is asthmatic, but you calm down because this is good for the economy. I don't think any mom will accept that.
So what role, exactly, what role do you think that the big corporations and big business could play better to protect, especially the children's health?
There are plenty of opportunities for business now on this green movement, or green economy, or sustainable, or common sense, as I want to call it. there are plenty of opportunities for the car companies on producing cars that are less, will not pollute it. Obviously, on promoting more better systems for public transport, on new technologies, and this is happening everywhere.
But do you think that they're taking enough action?
No, not yet, not yet, but it's coming. I have often the opportunity to discuss as well with the private sector. I think they see it, that fossil fuels are fossil, so we need to move on something else. Renewable energies, there is a big business on that. There are new jobs, there is a new economy, and probably will be much more. Those opportunities are there, and I think the rest is irreversible. I mean, there is no way to go back on certain things, and the new generation will not allow us either.
Apart from the big financial corporations, what about public health institutions, including the WHO? Do you think that more action should have been taken in the past, and is it getting too late now almost?
No, it's not too late, because you know, it's what we call in WHO the invisible killer. Air pollution has been, and it has been associated to all of these planet issues and our environment and climate change and how to protect the planet. And now we are using the health argument. So I think we are refocusing and saying, okay, you might have difficulties as corporation or as governments to move aggressively on a Paris Treaty to reduce the emissions and to protect the planet. But here we are. I mean, this is very much overlapping with our health agenda. And now, therefore, when the health is there, in particular 7 million, I think the speed will be changing dramatically.
And of course, the situation is different in every country, and every country has different challenges, whether it's here in Switzerland or elsewhere, and our children are obviously dying because of that.
Yeah, and I think that is a good point, because in fact, when you look at the richest countries in the world, I mean, think about the Scandinavians or the Swiss that you just mentioned, they are not polluting at the same levels as others, and their economy is very, very successful. So it proves that you can develop economically in a very good way without killing your citizens and destroying and polluting your environment. I think now the speed is on a completely different dimension, and again, I'm convinced that the health argument is the one that now will give such a push to this agenda that in a few years from now, things have to change dramatically.
What makes you so optimistic, Maria?
I'm passionate about what I'm doing. I know that human nature sometimes, even if you see the opportunities, even if it's so obvious, it takes a long time to react. But I think this time we are on a moment in a situation where all the factors are there, and particularly when you see that this is also positive, there are only positive effects that this is going to generate. Fight on air pollution is, for me, to live in a city where I can walk, I can interact socially, I can have a more active lifestyle, and therefore contributing to reduce the very heavy burden of non-communicable diseases and obesity. Having a very good public transport system means that I will not be stressed with my car and in the middle of a chaotic situation of traffic. So it's all about positive, and I prefer to live in a city like that rather than a city polluted, crowded, crazy, and perfect for having mental health problems as well.
Let's come back to your press release on Monday, where you said air pollution is stunting our children's brains, affecting their health in more ways than we suspected. Could you give some example from here in Switzerland of how this is happening?
Switzerland is fortunately one of those countries where the situation is probably among the best. But still, I mean, we have a fantastic geographical situation, a very good economic situation, so I will not accept any, excuses for not even better. Anytime in Switzerland I go to the supermarket and they give me plastic bags, I feel a little bit, why is Switzerland doing that? One of the most modern countries. They are going to kill me outside. But yes, we need to change that. We need to they did an incredible effort in promoting good public transport system, we still have a little bit more to do. And not only, I think Switzerland has a double responsibility because it's such a rich country and the well-being of the population is so much protected. I think we have to a double responsibility to be a champion and to be a model as well for others, and promote it and supporting and making sure that other countries will see it and they learn from those experiences instead of first polluting and then learning.
Where would you like the Swiss government to step up its action, and where should it take more measures as well on a global scale?
Yes, I will love. I mean, Geneva particularly is a very international place, and Swiss has been very supportive for this first global conference. We have, I don't know whether you have the opportunity to see it, an artist generating at the Place des Nations this beautiful simulation of 5 cities around the world, where you get in, there is a kind of tent, you get in, then you have the simulation of the air pollution in Beijing, or air pollution in, I mean, the air quality in Oslo, or Sao Paulo, or New Delhi, and you feel it, and this is a very good experience for citizens in Switzerland, who maybe they will never feel the level of pollution that in other parts of the world people is suffering every day.
Let's briefly talk about the financial costs as well. A World Bank report estimates that the lost lives and ill health, etc., caused by air pollution reached some $5 trillion a year. Would you agree with this estimate?
Oh, definitely, and we have even more. We have on Thursday at the conference, other data will be presented on the benefits of investing on tackling climate change and air pollution. Those who says that those investments will be too expensive, no, the trade-off, I mean, the benefits will be doubling the investment. And the other thing is that until now, for instance, in the agenda of climate change, the cost of the health of the people has never been included. I mean, the fact that exposure to air pollution will generate or is causing chronic diseases, those chronic diseases will require a long time hospital assistance and a long time treatment, and that's a cost as well for the society, and that cost has never been included. So now we know that if we put the two costs together, the benefits will be once again enormous.
So how much in total investment would you estimate is needed per year or in the next decade to fight air pollution and improve our health?
Nothing that will be dramatically high. It's just good sense, common sense investments, making sure that your citizens will have a good source of energy. I think this switch to cleaner sources of energy has to change the speed, and the benefits and the cost will be reduced so much. I mean, we need to accelerate this switch to cleaner sources of energy for our population, because we didn't mention it, but half of the world population is still cooking and heating their houses or lighting their houses, almost like in the Stone Age, on an open fire with wood or coal that the girls are collecting for hours, obviously not going to school, and therefore causing a dramatic problem as well.
So who needs to put more money into the fight against air pollution? Is it the WHO? Is it financial institutions, public health institutions, the governments, or, you know, private donors?
Yeah, I mean, WHO, as you know, is not a very rich institution in terms of financial support. We have our convening power and institutional power, but yes, we need more resources to do it. Governments need to invest intelligently. In fact, it's not a new investment, it's just making sure that they prioritize certain investments that will generate immediately health benefits. We need philanthropies as well, they need to help us. We need institutions, and the revenue, I mean, the benefits will be really enormous. But all of that will be possible if we keep this alert and awareness raising, and the society is behind us.
Here in Switzerland, the government is planning to step up its green policies by 2030, according to the UN SDGs, the Sustainable Development Goals as well. But do you think that these are enough?
As I say, for a rich country like Switzerland, it's never enough. I think we have this, is a very good achievement, certainly, but we need as well to make sure that others will follow this model. They need to champion a little bit more for others to follow, and they need as well to maybe use part of their capacity to support other countries to do this healthy energy transition, because this is where we will need more investment. We need to help people to transition to healthy sources of energy, which is not the case now. And this transition might cost some money, and those investments need to be done by the big countries and the big philanthropies and the big donors.
Geneva here is a hub for commodities, oil trading, shipping, etc. And there has been a lot of criticism that Swiss companies or multinationals based here, they actually outsource and offshore their air pollution elsewhere to low-income countries. How big of a problem is that, in your opinion?
Yeah, well, actually, this was one of the points of discussion as well this afternoon at the conference, on not only in Europe and not only in Switzerland, in Europe in general, we need to move to very important restrictions and normative in terms of our cars. Diesel cars being with a very restrictive normative. It's not only that, we need to make sure that we don't sell those cars to other countries, or we don't take our old cars with not the good filters for diesel emissions, and we send it to Africa or to other parts of the world. This is what a moral responsibility will require, and I hope that we will be very, very demanding on ourselves on this moral criteria that we need to apply.
Maria, thank you so much for joining us on The Newsmaker. It's been a great pleasure.
The same for me. Thank you very much.